So yeah, today we are talking about working in health and social care, and we are talking about understanding the use of effective communication in health and social care provision. So uh, the second LO we will be covering. So the indicative writing for the content that is indicated for this session is to talk about why communication is so important and why effective communication is so important in health and social care provision. So we'll talk about different methods of communication and different barriers of communication, what they are and what how can they be resolved, and why basically why communication is so important. And we'll talk a bit about data protection, recording, reporting, storage, confidentiality, sharing information. So the key terminology today is what is effective communication. So as you can see in this figure, so communication, if it's a two-way process, it's always more effective. So, and there are several factors impacting this communication. Um, and I'll just put my annotation on. So if you see, there's a sender who sends a message here, and this message is encoded. So the sender sends a coded message to the receiver. The receiver then decodes this message, and in a way, it shows what the receiver has actually perceived through the message. So what is the message that the receiver has received? And in terms of that, how has that message? Yeah, is everything okay? Yeah. So we're talking about how effective this communication is. Um, so, and then the receiver sends this feedback to the sender back. And this feedback then will assess how well the communication has taken place. Uh, this is a very important topic, and we will be covering a lot of stuff today. But in order to ensure that it's been completed, the objective is completed, I will have to break down this presentation into two parts, if that's okay. So effective communication in a care setting, it would help both the care providers and people who use care services to form good relationships. So the ultimate objective of,
Excuse me. Excuse
yeah,
me. Sorry to interrupt. But why are we not having this on our model yet? We not
why
the
do you
topic.
not,
Yes, not been up. It's not uploaded on the model yet. Yeah, okay, Unit 4 still unavailable on the model.
what is not available, sorry?
This unit.
Okay, the unit is not, okay, I'll just let them know.
Same thing was said last week.
Yeah, I've texted you that they've uploaded it. Do you still not have access to it?
It's not cleared. What is saying it's not clear?
Okay, I'll just have a look at it. Yeah. So, anyways, I'll have a look at that. And then, okay, so we will be talking about how a message is, what are the important components, and or what are the important factors due to which this message that you send is received in the best form, and the receiver gives you were expecting a positive feedback from the receiver, isn't it? So yeah, so effective communication, as I said, it's when people communicate. When do they communicate most effectively? It's when people feel relaxed. So it's the sender and the receiver, both of them are relaxed. They're able to, so the healthcare provider, they're able to empathize with the other person. and they experience warmth and genuineness in the relationship. So to be an effective communicator, there's several factors in this. So there's active listening, there's verbal and non-verbal communications. So there's certain non-verbal communications, such as our gesture, our eye contact, our uh, the way we are seated, whatever we are doing when we are whilst we're listening to the patient or the care service user, and so the proximate, what's the proximity that we have? Is it appropriate or not? Our facial expressions, and then active listening is very important. So we need to ensure that we are actively listening to the patient and not um, just having them to talk and not listening and talking in between. So effective communication will also require the care worker to develop and use a range of skills, abilities, and communication techniques in case there is a difficulty in any aspect that I've spoken about. So as you can see in this picture, there's a care provider, and she is listening carefully and actively to this service user. And the gesture that she has, it's a bit slouched. Her position is the way in which she's seated, which shows that she is accepting what the patient has to say. She is responding to what the patient is saying. And her gesture, if you can see, it has an element of empathy in it. And as you can see that this is an old age person who's speaking to her. And this is how it should be. So you have to empathize with the patient. And health and social care providers, they interact with patients. There's several patients that will be coming to you, so with mental and physical ailments. And social care providers interact with people who are vulnerable. They may have physical and mental impact. And there are other interactions also that happen between, like, it's just not the service user that you're interacting with, it's the families also, it's the communities that you're interacting with. So it's only effective, this communication, within when when everyone within the healthcare setting is able to provide information and communication which is understandable and is at the level of the sender, is at the level of the receiver, sorry. So the service user has to be able to understand what you're saying, what you're suggesting. So everything needs to be clear to the service user as well as to the family members of those service users. And obviously there are several barriers that we'll talk about. So those barriers have to be overcome. And according to Cypher Health, there is a continuation of communication. So it's not just one-time communication. It entails documentation. It has to do with change of medicines, regular checkups, follow-ups, etc. So there has to be a proper documentation, which you can see here. So if you do not have this proper documentation, it means that there's not a proper record keeping, and in that case, it is very difficult for the healthcare provider to have evidence or keep a record of what has been documented for health purposes. So CPD Online, it plays an important role in recovery and well-being of service users. And you can have a look at this, and it gives you more important information about communication skills. So whenever you listen to a patient or a service user, it could have a positive impact on that interaction that you've had with the service user, and that has a lasting impact. So if, let's say, you're unable to provide this required care to the service user, however, you listen actively to this patient with empathy and with respect, the confidentiality that they want, it has been maintained, and you make sure to preserve it, this itself can have a lasting impact on the patient and their family. So the service users and their family members, they feel empowered because you're keeping them at the center, and you're giving them a planned treatment, and then they can self-manage their treatment and um, whatever their plans are, whatever your plans are, they're shared with them. So it gives them more empowerment. The message should be simple. It needs to be simple, whichever has been transferred from you to the patient or the service user or to their family members. It should be clear and transparent. So there's nothing, no hidden agenda that you have. It should be very clear to the patient what they're going through and what are the different procedures that will be tested on them. They should obviously know of the consequences. There should be informed consent on every step that you have with them. So, and this would improve the relationship between the service users and care providers. And it then obviously this, if the care providers, they have a good relationship, this would have a good environment overall. And then the colleagues, your colleagues, your employees, your employers, they're able to work in a very good environment together. So, but then there's certain instances when this cannot happen. For instance, if there's a person who cannot speak to you, is into coma, a state of a comatose state, or they can't speak because of certain other barriers, such as they require a hearing aid or they do not have the literacy. So you're using certain jargons for which that person is not literate, or you're speaking in a language that the person does not understand. So those problems are there also that you would have to deal with. So health and social care providers, they need to develop communication skills, tools, and techniques. So you have to, for instance, you wouldn't require a translator. That's always there in hand. You make use of pictures. So then, if you don't have a translator for that particular language, but then there are pictures, so because people, they learn a lot from if you've given them proper examples through pictures, or you've given them um, you've given them a good can everyone listen to me? My connection is okay.
Yes, I can hear you.
Yeah. Okay. So then okay. So what happens is that if if you have good pictures and you have good examples as pictures, these can be shared with those patients or those service users. So they'll make use of whatever you have to say to them if they don't understand your language. So make your language as clear as possible. Your message should be as clear as possible. So care providers, they've research has shown that they make use of different communication techniques. So, for instance, if there's breaking bad news with the patient themselves or with the people who are related to the patients, you can have like non-verbal communication, such as touching the patient, touching their hands, having a good eye contact, having good facial expression, appropriate facial expressions when required. So this requires a lot of, it's a technique that has to be mastered, and it has to be, you have to be trained, well trained, when you're obviously coming across people from all communities, so there might be a cultural barrier due to which you're unable to touch the patient, but you have your eye contact and your facial expressions there. Whenever these communication techniques, they help when you're giving or receiving information about whatever care you're providing to an individual. You're providing emotional support to an individual or a family member, or you're carrying out an assessment of an individual's care needs. So let's say you're doing an examination on the patient from just touching the pulse of the patient. So that should be obviously have cold hands, it's a good gesture to say that just apologizing that your hands are too cold, or just making sure that they're in a comfortable position. All these are just good ways of communicating, making the person who you're interacting with more comfortable. So when we explain the methods of communication used in health and social care, we talk about different sorts of communication. So there's verbal communication, also obviously by telephone, it's by it's a face-to-face communication. There are different ways, places where you can communicate with the patient, with the service user. So telephonic communications. So verbal communication, we understand. Every sort of communication has their limitations. So for instance, if we have a verbal communication on the telephone, you have a certain amount of time that you can spend with the patient, with a particular patient. So if that patient, if you have just 10 minutes, let's say, and that patient needs to speak a lot, then you would obviously want, so there's no point in having a communication that is just very short-lived and just for the sake of a communication. No, that should not be the case. When you're giving quality, you need to make sure that the objective is achieved in the way it should be achieved, have the best outcome. So you're looking at the outcome because you're making it patient-centered. So telephonic conversations, that's why they have this problem that they can't interact with the patient. Seeing the patient is a problem. You can't make the patient see yourselves. That's a very big problem that could occur. But then again, during COVID-19, we had no other choice. So, and with the heavy load on healthcare, we have to sometimes jeopardize on not have face-to-face conversations. But even in face-to-face interactions, you can make interaction um, memorable for a person and achieve what you want to achieve. Or you could go the other way around in just filling in the space and just having the conversation just because it has to happen. That should not be the case. So always make sure that your communication, whether verbal, whether non-verbal, any other form of communication, should achieve the objective of leaving a customer or a service user satisfied at the end. So non-verbal communication, such as your body language, your smiling face, just putting your sleeves up, elbow length, could also help, just to make them aware that you're there and you're giving them a safe environment, a respectable environment that they require. Appropriate eye contact should be there. I know you're busy writing down your notes here and there, but those scribbles should be so short-lived that not impact that communication between you. Then that's a non-verbal communication. Again, you're giving an impression that you're not really listening, you're writing down more. But actually you are listening, and that is why you're writing, but that writing should not be so much that it impairs your communication or it impacts your communication with them in any way. So written communication should always be there. It is important to have records, formal communication, and preparation of reports. Written communication used in health and social care sector. So if you have that written communication, it is like a record keeping, and that should be there for anyone to access it, but not everyone. This we need to make sure because of certain confidentiality issues. We have the British Sign Language, which is used for people who have impairments. So making use of AI has shown that it has enabled people who are blind to see to a large extent. But then this requires a lot of time and a lot of obviously intelligence into this AI method. So at the moment, it's still evolving, but what you can do best is in order to not let this disability impact your interaction or your patient outcome, you should make sure that hearing, you have communication barriers there, you accept that those barriers are there, you know those barriers are there, so you work beforehand to assess whatever are the best ways to remove those barriers as much as possible. So you can have interpreters. This is people who listen to a person speaking in one language and then communicate what they have said to the second person in a different language. And then translation is again more or less the same as an interpreter, what an interpreter says. And then signers, the British Sign Language, they use that. It's also called Makaton, in which whatever is said is then transferred to the person who has a who has a disability, and they understand through that sign language. So there are different signs and symbols of reference. So sign languages can be used, as I said, they're graphical methods also of communicating. Other objects of reference can be used, such as toys, clothes, jewelry that people have that keep them. Like for instance, if you have a certain toy in your room while you have a patient who's a minor coming in, that could help if you're communicating with that patient, and that could then give some comfort to that patient. So anyway, any possibility of going further just to have good communication with patient, it's essential that you have these things in mind. Then you have certain technological aids. You have videos, you have video phones, you have people who sometimes find emails hard to track, and then you can use different other ways of communicating with them. You can have certain people are more active on social media, so you can ask them whatever ways of communication are easier for them to access. So, for instance, if you have a group on social media of your patient and certain other care workers, they can communicate together and in one way also, and that communication is also the objective is being achieved. So there's no point sending text upon text messages or emails to someone who can't access them. So what are the barriers? If I ask you, what are the main barriers in while you're communicating?
The connection is bad, please.
I'm asking what barriers do you know of in health and social care? Can everyone hear me?
No, the network is bad.
Yes, I
Health
can.
and social care, yeah. So what are the barriers that to communication in health and social care services? Any idea?
Cultural background.
Okay. I did not get any answer. So here, the different barriers that have been researched, and we've come up with some main barriers. So there might be many other barriers also, but some of the main ones are, so let me have a look. Yes, it is. So the condition of the service user is very important. So what condition are they in? Do they suffer from a serious mental or physical condition that makes communication almost impossible for them? Competing demands. So sometimes there's so much demand on the healthcare itself that you cannot so there's, again, as I said, there's a whole list of patients that you have to look to. And because of that, your communication cannot be proper with that patient. And that is what the main problem is. So because you wanting to communicate with that patient, but the time slot that patient has with you is very limited. So for instance, if the patient has a mental health condition, has dementia, it's hard communicating with that patient, and you have another list of patients to communicate with, then that impacts your interaction with this patient. Lack of privacy. So a patient may hesitate to explain his or her problem if there are other patients around, if there's interruptions between communication. And this is one very important barrier. So the patient has to be given respect at all times, and their privacy has to be maintained. Even if they don't ask for it, that is understood. So language, it's again, as I spoke earlier, a very important barrier that should be tackled earlier. So if there are translators, if there are persons who can interpret a language and then transfer it to the other person, that would be very helpful. And then we have certain norms and cultural preferences. So for instance, if there's a person who wants to communicate, if there's a female who wants to communicate about a certain gynecological problem or a certain intimate problem that she would want to discuss with her care provider, and that care provider happens to be a male, it is hard for, in certain cultures, it's hard for a female to express her problem to a male care provider. In that case, you would ask that patient if they're okay to express their problems to you. Otherwise, you could ask for, like, if you could arrange for another person to be there, or another person instead to take to handle that patient. Or you could also always ask for a chaperone if that patient is not comfortable sitting on their own with you for any purpose. So there's certain poor communication skills. These are like, for instance, if there's a disability, the patient is unable to hear properly, to see properly. The cultural differences, as I just mentioned, environmental problems. So whatever, where the patient is seated, the extremes of temperature, lighting isn't proper, any other condition, it's not pleasant to be there. Then you have language differences, health problems. So for instance, if that patient has certain extreme health problems, they cannot communicate with you. If that patient is comatose, can you please mute yourselves? I again request you, please. Thank you so much. Again, your dialect, what type of dialect you're using. There's several dialects that are used over here. Some people might not understand what you're saying, so be as clear as possible. Emotional distress, if there's a patient who has emotional distress, it is very hard to communicate with them. And then you have all your non-verbal communication skills that come into action here. Jargons, slangs, and acronyms are very important to remember. You cannot use these forms of communication just thinking that the patient would understand is not appropriate. And then sensory deprivation again, the patients who have sensory difficulties that would have to be dealt with. So here all these factors, they have an impact on your communication skills. They need to be understood well in advance, and there should be ways to tackle them. And those should be there, and proper researched ways should be there. So here we'll describe the information of handling and recording procedures. So there are different procedures that you have to go through with the patient. How do you handle them? How do you record them? How are they stored? What are the rules and regulations under which you're doing all of these procedures? So there's the principle of confidentiality, which covers the main privacy, the right of privacy of every service user, and respecting their health and social care settings. respecting their wishes in health and social care settings. So a person might have a wish of not disclosing a certain information to anyone. And let's say that information is vital to be shared. But then it's again, what do you do in that situation? How do you go about to handle this situation? What are the prerequisites of handling such a situation? We'll learn about this. So a service user would not share any personal information. If that information doesn't need to be shared, you don't need to share it with anyone, except obviously with your manager, who needs to know everything. So you have to have this understanding. They need to be sure that you would not share this information with anyone. In only this instance will they share with you the complete and true information. So their their wishes need to be listened to and respected, especially when they're older age people. So an understanding of legislations is very important. So we have a list of legislations. So for instance, we have the Human Rights Act 1998, which says which respects the private and family life of every individual. The CARE Act 2014, which has a person-centered approach. We've talked about it a lot previously. Health and Social Care, which entails Service and Quality Act 2015, which has integration of information related to service users, and the Data Protection Act, which we have so many times we come across it. Now, this is related to employees and service users in any care setting. So all of these need to be explicitly explained to the sorry, and they need to understand what these mean. Accessing policy is very important. So you need to have an access policy in place within your care setting, in which whoever, it should be specified who can access a certain information. So for instance, nurses have access about what treatment would be followed, whereas doctors have full access to the patient's records. And that all that information doesn't have to go to the nurses. So whatever everyone in the team, what level can they access a certain information is very important. Needs-based sharing. So whatever is needed has to be shared. Whatever is not needed cannot be shared if that patient doesn't consent. And then again, considering the patient's own capacity, is that patient capable enough, or does that patient have or doesn't have that capacity to make that decision to share or not share that information. So that has to be assessed also. So if the patient is not in their senses, they're comatose, they have severe mental illnesses, they have a serious condition in which they lack capacity, then this has to be communicated with the care provider's families. The care provider needs to mention this to the manager, and then a shared procedure should be followed in order to understand what should be shared, what could be shared, and what could not be shared with the others. So here we explain the principles and practices that relate to confidentiality in health and social care. So confidentiality, as again I said, it's information about service users or patients, and it needs to be treated with confidentiality and respectfully. So members of a care team, they have this responsibility to share confidential information when it is needed. And this is basically for the safety and effective care of an individual. So it should be in the best interest of that patient. And information that is shared for the benefit of the community, this should be anonymized. For instance, if there's a patient suffering from HIV, and that patient could go and infect others based on if they have certain habits, and that though the other people who are vulnerable, for instance, the spouse, if that spouse is vulnerable to contract that infection or any other sexual infection, that could have an impact, a negative impact on the health of this of the partner of that patient, then that information should be shared. Or if it is against the wishes of that patient, then there should be ways to protect that patient and obviously everyone who is around that patient or related to that patient. So yeah, so information that is shared should be anonymized if it's for the benefit of the community. If you're working in a health and social care setting, it's important that you have an complete understanding of what confidentiality is. Yeah. Any questions so far? Do we have any questions?
Yeah, I would like to dwell on the confidentiality. If, for instance, you
Yeah.
said the patient is HIV, then what of our fellow health colleagues? Do they deserve to know that, or should we not tell them? Or maybe like the second one is like a patient is suicidal, and he or she comes to tell you that, yes, I want to kill myself and I don't want you to tell anybody. Will it be will it be right for me not to tell anybody, even my line manager or anybody?
Okay, that's a good question. Can anyone else comment on whatever you've experienced so far related to such?
Yeah, I think for the second one of the suicidal, you just have to tell your line manager. At that point, the confidentiality, you have not breached that information. So because you telling your line manager, you're acting on the person's best interest, right? And the HIV, will discuss it with your colleagues. Well, I cannot say yes, but I feel rather than telling colleagues, your line manager should be aware. The line manager should be the one to pass the information to your colleagues. That's what I feel anyway. I don't know if I'm right.
What's happening?
It's like the tutor is out, so probably our network is bad.
All right. Thank you.
So yeah, we were just talking about HIV. Yeah, so any other comments? So yeah, for your question, I have an answer for this. Everyone can see my screen, I hope. So we have examples for this in the following slide. So if there's a patient like this, and you're concerned about their safety, so obviously whoever needs to know will need to have access to that information. So it does not mean that everyone has to have access to that information. No, it is only those who need. So it's obviously your manager, your line manager, whoever's your higher up, they need to know everything that is happening, obviously, because they're at a level of understanding of what has to be done and what should be done. And to what extent, obviously, you have to work in the full interest of that patient. So to what extent do you go on to share that information? Now, that information can be shared with their, obviously, with their with the people who are in with them, their loved ones, but in a way that doesn't jeopardize. So now you understand that this patient is suicidal. So if there's a suicidal person, they might as well have this um, tendency of harming not only themselves, but they might harm the others also. So you have to make sure that the others are also safe. So in that case, obviously, proper rehabilitation, proper information sharing should be there, making sure that the patient that you're, or the service user that you're communicating with has this information, so they know what information you're sharing with the others, and who are those others that you're sharing this information with. So obviously their extended relatives don't need to know, but their children don't need to know. If their children are minors, if they're just but if they're adults, they need to know that this is the situation and this person has a tendency of harming themselves and those who are around themselves. And this is why we are taking these necessary actions, just to make sure that everyone is safe and the patient is safe. Because if you're hiding this information, there is a probability that they could just take their lives. They could take the life of the person, or they could harm that other person who is with them under their care, or they could even harm a social worker, a healthcare worker. So all of this is very interconnected, and you have to make sure that whatever authorities need to be involved would be involved. So the principle of confidentiality, it's about privacy, and it's respecting someone's wishes. The professional should not share this personal details about anyone unless the person has said. So personal details that are not, that keeping them confidential does not harm anyone. That has to be made sure. And if there's a health and social care setting, confidentiality would mean that the practitioner needs to keep a confidence. That should be a level of confidence between themselves and the patient. And that's a part of good care practice. This means that the practitioner would not tell anyone that a patient has said that the details or any other thing could be shared. And this would also include not showing anyone, again, anyone who doesn't need to know, an individual's personal notes or computer records or anything. So it's, even if it's your close colleague, you don't need to share this information with them if they don't require this information to be shared. So there are different legislations that cover confidentiality in health and social care. So there's the common law of confidentiality. So this principle is taken from the common law. So it is important for encouraging people to come forward with issues and concerns if there's a confidentiality issue. So let's say there's a victim of female genital mutilation. There's a girl and she undergoes this, and this is a criminal offense, you know that, and you need to let the appropriate authorities know. So all of these rules of confidentiality, they're all listed in the legislation. You will have to have a look at them and have to have an understanding of them, that what is considered appropriately sharing and what is not considered material that should be shared. So it's a serious safeguarding concern, and whoever's at risk, you have a duty to share this information to keep people safe. So there might be other females also who are at risk of having to go through this criminal offense. Then you have the Human Rights Act 1998, which says that every individual has the right to respect for their private and family life. So that needs to be kept confidential, and there's a safeguarding concern, if there is any, that needs to be taken care of. And then you have the CARE Act 2014, which encourages caregivers to take a person-centered approach when you have safeguarding issues with vulnerable adults who lack capacity. So it sets a new way of thinking with regards to adult social care, and it explains the importance of sharing information at early stages so that you have people staying safe. And then GDPR, we read this on several documents. Before that, we have the Health and Social Care Safety and Quality 2015 Act, and it talks about several provisions within the health and social care services in the country. It integrates information that is relating to users of health and social care services, and it's a good document to look at when you have when you want safety and quality within your organization. And yeah, then the GDPR that I was talking about. So the GDPR mentions your personal information, and you should make sure that the patient who you have or the service user who you have with you has a good understanding of whatever's mentioned in it. So this personal information, it says, must be processed lawfully, fairly, transparently, and it's collected for specified, explicit, and legitimate purposes. This has to be mentioned there. There has to be adequate, relevant, and limited information to what's necessary for the purpose of why it was collected. It should be accurate and up to date. Whatever's being informed, updated should be there. It should not be kept for longer than how much time it is required for. So it's not keeping it forever and then using it for other purposes. That is not there. So in some time, it should be made not accessible. It should be processed in a manner which is appropriate, with appropriate security that includes protecting against accidental loss. So when can you breach confidentiality in health and social care? So again, coming back to your question, sometimes you can override your duty of confidentiality. So if you have information that suggests that a person or client is at risk of harm to themselves or to anyone else, in these instances, you need to let your manager or supervisor know, and you should be able to provide more, like this information could be shared to a wider extent if required. So I'm coming to a scenario, and then we will end this presentation at this point, and then we can have the rest of the presentation tomorrow. So you have this scenario. Not reading through it, I want you, all 5 of you, to read this scenario and explain to me what would your say be in this. Just take a minute or two to read this and let me know what would you do in this instance. Yeah, does anyone want to answer?
Yeah. In this situation, you have to report to depending on your safety lead or the manager or anything, because it's a risk abuse. It's an abuse. It's an
Okay.
abuse. We have to report to the safety lead, manager, or supervisor.
Okay, thank you. Anyone else?
Hello?
Yeah.
There could
Yes.
be continued harm.
Can I talk?
Yeah.
Yes. It's an abuse.
Mm-hmm.
But at the same time, if the kind of issue of occur, or if that kind of things has happened to the resident before, if they have, say, the series of dark cases, because sometimes I've seen a situation whereby the residents lie against the carer, and that's not the first time. It's not the second time. It's an abuse. But as far as the person going there for the first time, taking care of the residents, he needs to report. So if something like that has happened before, I know the manager won't take it serious. That is the way I know, but the person has to report.
Okay, thank you. Anyone else?
Hello.
I think
Yeah, hi.
I say firstly, the person should confront his colleague that was accused of that abuse and get the factual information first, then before taking further actions. Hello.
Yes, I can hear you.
can I talk now, please?
Yeah.
I think as a care worker, they haven't seen the full picture. They don't have the full picture of what's gone on and what's not gone on. So for that, they need to inform the manager who can take care of everyone individually, take each person's information, what's gone on, and they have to make this decision. Putting that much stress on the care worker would be not right. So that's why overriding confidentiality is necessary.
Okay, thank you. I hope everyone has had their comments. Yeah. So yes, thank you so much, everyone. This is a conflict again. You can see. So as you know, that this gentleman has begged you and told you in confidence whatever's happened. So you don't want to breach this confidentiality. However, you should definitely inform your manager immediately and report the other staff member also. So again, because you don't want this to be continuing, this is so important. This is something that happens so often, and we overlook this important conflict that happens. So yes, definitely, it has to be so that obviously in this situation, it is acceptable to override your duty of confidentiality, because it is more necessary to protect this information, this person giving you the information from further harm. And you need to explain to this person that you understand why he is upset, and the wanting not to speak, you know that. However, you're saying you're doing this only because you're making that person safe, and you're making him sure that that person is respected and protected. So this would be acting on behalf of this person's best interests, and it also has the Public Interest Disclosure Act in it. So this means that you would have to override your duty of confidentiality, protect his confidentiality, and speak to your manager about what you have found exactly. So the five, this is the last slide that I would be talking about because of the time. So certain factors that you have to evaluate that can influence the maintenance of confidentiality in health and social care. So these 5 confidentiality rules should be in always there in front of you. So ask for consent to share information. Always ask that. Informed consent. Consider safeguarding whenever you're sharing information, and you should be aware of the information you have and whether it is confidential or not. So whatever information, even the slightest of information that you have, you need to make sure if it's confidential or not. Keeping records whenever you share confidential information. So these records, so if the person has no records, if you don't have any records about anything that happened, those that could go against you. And be up to date on the laws. So you should know laws and rules that surround confidentiality. If you don't, you should look at them time and again, because they change. A lot of changes have been made. So you should have the updated changes. How do you maintain confidentiality in the NHS? So confidentiality and respectful treatment is there for every patient, for every service user. So members of a care team, they need to share confidential information when it is needed for safe and effective care of individuals. Information that is shared for the benefit of the community needs to be anonymized. Again, I mentioned this before, that whatever information that you are sharing, again, just let's say that a patient has a deadly infection that could spread. So that what happened with COVID-19, that information, if that information would have not been shared, that person might have been jeopardized, but then there's so many more people who are jeopardized because of not sharing that information with the appropriate people. So that's about it from today. If there are any questions, I'm happy to take them.
Hello, please.
Yeah.
I've not been on the last two session or three session. Please, can I get the recording?
I'll let them know. Yeah.
Okay, please. I'd like to have
That's
them.
fine.
And I want to ask, is there any assignment or anything?
Yes. So the first session that will be shared with you, it's regarding the assignment. So the assignment discussion is ideally done at the end of the last learning objective. However, because I had this feeling that if you know what your assignment is, because these assignments, they're always uploaded on Moodle, what you have to do, what is expected from you. So I've actually gone to discuss in the first session, if you when you get access to it, you would be able to see the detailed, not very detailed, but a succinct detail of information about the assignment. I have shared this specifically because if you know that whatever you have to cover in the assignment, you then know what to focus on when you have your lectures over the weekends.
Okay, thank you. So the assignment is on the Moodle?
Yes, the details would be there on Moodle. I'll make sure that you get them, you have access to them.
Okay, please. Thank you.
Okay, you're welcome.
Okay, so, and when next are we having our lectures or classes again?
So your next lecture will be continuation of this lecture. It will be tomorrow at 11 a.m. UK time.
Okay.
Okay.
Thank you.
Yeah.
Hi.
Hello. Yeah.
I'm just asking about assignments. Do we have specified dates now for when we need to get our assignments in by? I'm just a bit new. I have been for the last few sessions, but actually listening in, I haven't been able to do it correctly. So, are there any assignments now that we need to do? I do know that we before I started these lessons, there was a lot of assignments that I've missed, and I'm trying to catch up on them, and I haven't done this one yet, this topic, the Unit-4.
Okay.
So I'm just at the moment I'm catching up. I don't want it to be that I'm missing my actual deadlines because I'm catching up with the old work.
Yeah, if you could just email this on this link. I'll just share this with you. So any concerns that you have regarding your assignments or anything else, please email on learnerwork@ukversity.co.uk. This is for this, and then your submissions should also be, so submissions of assignments, you have a deadline obviously for this assignment. it's after 2 weeks of completion of the units and its delivery. So ideally, we are doing this once we complete this learning objective, the second learning objective, because it's taking a bit of time. So this last objective will be, obviously, the last session will be based on your the assignments, the discussion on assignments. So once that's there, you will have 2 weeks time to actually work on your assignment. So if
you deal with those assignments again, because as I was saying, I haven't submitted any of my old assignments, so I speak to whoever I need to on the email about them.
Yeah, so you could
Because I haven't submitted any type of assignment yet, because I'm just trying to get it all done.
Yeah, so you would have to email them. Yeah.
Okay.
Just email them and let them know. Yeah, because I check assignments, but I am not the one responsible for they're the administrators, and they're the persons who are higher than me. So they would be able to understand your situation and let you know what's best.
Okay, thank you.
You're welcome. If you could have a look at the first learning objective, I've shared a brief overview of what your assignment would be. And yeah, you could have a look at it, but otherwise, ideally, it's the last session. So you have 6 learning objectives. We are covering learning objective 2 at the moment, and tomorrow we'll have a further discussion on learning the second learning objective. And yeah, so it's going to take some time for this assignment to be submitted. But if you know, obviously, earlier on what the assignment has in it, what you're expected to do, then obviously you can work better. I believe that. Yeah, someone else had their hands raised.
The one is still regarding the assignment. So, but I was hoping that what if you are not able to meet up the deadline? So how do you go about it?
Yeah, so that's just to email them, to make sure that you email them and let them know, because as I said again, I don't have a say in that. I am therefore delivering the sessions and checking the assignments.
Okay.
Yeah, but I cannot do anything beyond that.
All right, no worries. Yeah, thank you.
Will we receive feedback before actually you marking our exams? So if we send it in, will you check it and then tell us what's wrong with it and then resubmit it?
Yeah, I can do that. I'm happy to do that. But I can, for the references, please make sure that you have your references properly done, because that carries marks. Make sure that you do not copy paste stuff. Make sure that whatever the requirements of the assignments are, that's up to date. So if that is in hand, so if they're like, let's say 30 or 40 references, I'm just giving an example. So I won't be able to go through all the references to make sure that they're okay. I'll just give a brief overview of what I think the references are and should be like. But I can give a general feedback. Yes, that I can do. And you would be submitting your work on this email that I shared with you. And you could ask, and it would be then shared with me if you're submitting earlier. So obviously earlier means once you've covered your 6 learning objectives, and then the 7th session will be, the 7th learning objective will be covering your assignment. And then after 2 weeks, you could, so it's the submission is after 2 weeks once you're done with your lectures. So if you submit before that, obviously, that doesn't mean that you submit 2 days before that, but you do give me some time, please, in checking your work. So it does take time for quality check. So because it's not only me, it's other people also who have to go through, the document has to go through a check first through the department, and then it comes to me, and then I'm able to check and then give feedback to you. Is that okay?
Yeah, like I did submit my Unit-3 yesterday.
Yes.
But
Yes.
I forgot to put my name on top. Should I? I don't know. But I sent it through my email. Will it be all right, or should I resubmit it again with my name on it?
Just resubmit just to make sure. Either they'll accept it or they won't. I'm not sure. Whatever. But if your name is not there, you would still pass this module.
Because I submitted through it my email anyway.
Yeah. No, that's okay. But yeah, some things need to be taken care of. So if you have a good look at the guidelines, you would be able to understand what we actually require from you. So there's certain guidelines that have to be followed. Please have a look at them properly.
Have you sent that to us? Because I've never seen any of that, and I haven't been in the first few lessons. If you did explain it to people, if you've explained it to them, I don't think it's been explained to me.
Yeah, it's all on Moodle. If not, then I'll let them know. I'll ask them to share it with you.
Okay, that's fine.
So ideally, we do not share this. We don't give a presentation on this unless like it's the last learning objective and that's been completed. So I would have done this at the end, but just because I felt that you need to know what, just a brief discussion on the assignment. It's helpful for the learners just to stay more focused. That's the only reason why I did it. Other tutors might not do it. It's up to them, but the general protocol is to discuss the assignment at the end. Yeah. So it's the first learning objective that has the assignment discussion in it. I'll ask them to upload it on Moodle. If there are no further questions, I would end this session and I'll meet you tomorrow. If any other questions that you have, any issues that you have, please email on this email that the link that was shared with you. Thank you and have a nice day.
Oh, please,
Yeah.
I'll not be able to attend tomorrow. Can I get the recording, please?
That's fine. Yeah. Is that okay? Okay, then that's goodbye from my side. Have a nice day.
All right.
Yeah, bye.
Bye-bye.
Bye.